What's up, everybody? Dr. Courtney here, your New York City board certified orthodontist and teeth whitening specialist, and now Botox at Smile Pop in New York City. I'm up here in Rhode Island. It's rainy. I thought, you know what? No time like the present to make a YouTube video about injecting Botox into your clenching muscles, the things that cause inflammation in the TMJ, headaches, all that, and basically wake you up at night, at least me. I'm looking a little bit more tired than usual these days. I got a 3.5-month-old. He's got a big personality, just like his mama. Just kidding, he's actually great. He's taking a nap, so here we go. Let's dive in. Anyway, today I want to talk about Botox for clenching. I have had a lot of patients come in lately that talk about how much they clench and squeeze their jaws together, and guess what? I'm one of them. I wake up clenching my teeth so much, and it got to a point where I started getting ear pain, and the ear pain would radiate from like deep in one ear and would go to the other. I thought it was an ear infection. Turns out it was just inflammation in my TMJ. Today what I'm going to be doing is I'm going to be putting some Botox into my masseter muscles, so those are my clenching and grinding muscles, and a little bit of my temporalis muscles. Both of these are muscles that contribute to clenching and over squeezing of your teeth. The brand of botulinum toxin that I'm going to be using on myself is Xeomin. One, I have it on handy. It's a real difference between Xeomin and Botox Cosmetic is Botox Cosmetic has an accessory protein attached to the botulinum toxin. For me, that personally gives me headaches. I'm a little bit sore at the injection. This is considered your naked neurotoxin because there's no accessory proteins, but just as effective, takes the same onset to show, lasts as long as Botox. So today I'm going to be using Xeomin. Now, Xeomin actually comes as like a little powder here, and you're thinking, how the am I supposed to inject that into myself? Well, you actually, in order to activate this, you have to add some saline, which is basically salt water. So what we're gonna do is we're gonna reconstitute that. You wanna clean the lids of these guys with alcohol. And so what we're gonna do is we are going to drop some of the saline, aka the proper dose, in order to mix with 50 units of the Xeomin. So for me, that is 1.25 mLs of saline. So here I got that drawn up with my larger needle. This is not the same needle that we use to inject in the sites, but this is what we use to reconstitute. Now here's what's really cool. So this Xeomin is vacuum sealed, which means it's basically free from all the elements, bacteria, yada yada. So when you actually break this vacuum seal with this needle, you will see this saline gets sucked right down into the Xeomin. If it doesn't, this was tampered with. So I didn't even touch the plunger and it just got sucked in because, again, it was vacuum sealed. So now you just want to gently kind of roll the saline around and mix with some of that powder, and now you have something that you could actually inject with. Holy cats, it's raining, gotta go. Okay, now we're indoors. So now that this is mixed up, this is something that we can work with to inject into our masseter muscles. And so in order to inject that, I use a 31 gauge needle, and I kind of do that in all the areas. But I'm gonna inject 20 units of Botox in each masseter muscle. Maybe I'll do 15 and 15, 5 and 5. But I ultimately want to put about 40 units of this in order to get the effect to help minimize some of my clenching and grinding. So I'm slowly filling up one syringe. You want to do it at a slower pace because otherwise you'll incorporate bubbles in this, and you don't really want to inject air. 1, it's wasted product. 2, last thing you want to do is get air in a vein or anything like that. But for me, I think injecting into masseters is a very simple technique. You need to be careful. If you inject in the wrong spot, you can affect some of the smiling muscles, and then your patient looks like they had a stroke, meaning like one side of their face looks dead. So I drew that up for one side, drew that up on the other. And so I've been doing Botox for 11, 12 years now. And so I know how much to draw up, how much each measurement is, how many units of Botox is in each one of those. Okay, so you want to make sure you apply alcohol at the injection site to make sure everything's nice and clean. For my patients, we'll apply ice to kind of numb the area. For me, I just raw dog it. And so you can see You can see how my fingers kind of pulsating back and forth when I clench and squeeze. That's kind of like the thickness, the body of the muscle. So that is the point that I'm actually going to inject. And so I'm using my mirror over here to the right. I'm going to squeeze. And then simply push all the way in. I'm going to leave a few more units just to do my temporalis. Great. And then my temporalis muscle. You can see how that muscle's pulsating there. We're just going to great. Same thing here. We're going to identify the body of the muscle. That's where I'm going to inject. And then I'm going to reserve a little bit more up here for the temporalis. You can see that pulsate there. We're going to put right. Ooh, that's it. That's a spicy one. And there you go. And this is going to start to take effect on me. It typically starts to kick in at maybe 3 to 5 days, but I will start to get relief. That ear pain will start to go away. Things that I can help do now in order to help minimize some of that ear pain, which is some inflammation that's actually present in the joint, is take some NSAIDs, non-steroidal anti-inflammatory medicine, just to kind of decrease that inflammation. So anyway, I wanted to just show what it's like to put Botox in your masseter muscles or in your clenching muscles to minimize your clenching, grinding, and TMJ. And so does this stop clenching and grinding? Well, it minimizes the muscular strength. So eventually you do tone down clenching. However, it's typically stress related and habit related, so it can come back. Thank you so much for tuning in. Again, this is Dr. Courtney Berry, your New York City board-certified orthodontist and teeth whitening specialist, and now Botox at Smile Pop in New York City. And as I like to tell everyone, go on and share your smile with the world.